White coffee?
I'll have coffee with milk and sugar.
Yes. Yeah. Huh?
Can I have 1 cup boiling water? Just water?
No tea?
Just water?
Black tea.
Can I have a little milk?
Little milk. Yes.
दुध पातलो छ क्या बुढोलाई थाहा छ के सोध्दै बनाएर
Welcome. Kasi dile.
यहाँ बुढो बालाई बनाउनु दिएको छैन सोधौँ
Coffee.
Cough. And what's it? What?
Breathing too much dust, cold air.
Well, Martin. I'll leave you two together. You can discuss whatever you want. When this cough or the discomfort beginning?
The cough,
The cough.
started about 6 days ago.
When you are in Lukla?
No, we started from Yuri,
Mm-hmm.
and then we went up from Yuri to all the way through Sete and up to. We spent 2 days in Namche acclimatizing. But I've got some antibiotics that I've been taking, and actually the cough is getting slightly better.
Now it's better.
It's better than it was, yes.
Okay.
But just so you know, a little bit about my history. I suffered from cancer for 6 years.
Mm-hmm.
I had
Could you give me your finger, please?
I had a whole load of 4 sets of chemotherapy.
83 is not so bad. It's the oxygen saturation. Is how many oxygen do you have in your red
I
cells?
see. All right.
That's
And as a result of my chemotherapy, I know
okay.
my white cells are slightly low and my blood cells were slightly low.
Mm-hmm.
But what you're seeing there, they're at a reasonable level now.
Okay.
Altitude. It's taken me much longer to acclimatize from about 3-5 upwards.
You have headache? Headache?
Only after I cough.
Mm-hmm.
When I cough violently. I
Yeah.
get a tickle here and it's very difficult to stop. Then I get a headache.
Uh-huh.
But I haven't had a headache,
At
I
all.
don't think, as a result of altitude sickness. I don't know. But,
But you have you eat?
my appetite is fine.
Okay.
What do you want me to do?
Could you take off
Yeah.
your... Now it's not so cold.
That's very kind of you to look at me there. just needed some rest. And I was taking longer to acclimatise than the rest of the team. But
have a okay, your wrist.
so you were looking after this expedition going up Everest,
Yeah.
That's brilliant.
Yeah. $70. It's okay. I'm glad that moves.
My pulse rate is normally about 60.
Well, your pulse is 89. It's a little high. I don't think so that you have fever, because if you have fever, it's over the 100.
Right.
And that's not happened. But I'm a little scary about what happened in your lungs.
Right.
You know?
Yeah.
Because just let me see what are inside of the lungs. Okay, thank you very much, Matthew. When you feel the cold, please breathe, okay? Deeply.
Right.
Okay? Breathe. Get up. Again. 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 Okay. Could you put your in your ears?
Right.
Because I like to hear you what happened. Okay. Okay, breathe. Do you hear?
No, I haven't actually.
Do you hear?
No, I didn't.
Oh, it's water.
It's water, is it?
Yeah, it's water.
Oh. What does that mean?
Come on, over. Again. 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 That's a war place. The left lung. The base of the left lung.
Right.
Okay, that's enough. Thank you. How, no, just the last place. Could you put
To relax my muscles.
painful? No? That's for looking if there are some broke rib. painful?
No.
Okay. Right. Your ribs is okay. You see me now. Okay, you could put all your gear, please. So, it's up.
Yeah, okay, tell me.
Well, do you have another problem before? You tell me about the cancer. This cancer.
Yes.
Which cancer has?
I had Hodgkin's disease.
Okay, Hodgkin.
Okay, quite badly.
Yeah. And do you have another problem, lung problem or something like that?
At one stage, I got a blood clot on my lung just during my treatment,
Uh-huh.
and I was rushed into hospital and given oxygen and all this
Yeah,
stuff.
because it's like, embolia. Pulmonary, pulmonary embolies. Well, okay, well, we have a problem here, Martin. I'm happy because you don't have AMS, acute mountain sickness. Your oxygen saturation in your red cells is not bad, okay?
Right.
Your vital signs, it's okay. But I'm scary. I'm quite fear about your left lung. It's quite full of secretion,
Right.
the base.
Right.
And at this altitude, if you're going up, it's coming like a pneumonia,
Right.
you know? And it's very difficult because there's less oxygen.
Sure.
If you're going up, the infection don't stop.
Yes, yes, understood. I wasn't intending to go up.
Yeah.
I was intending to stay here for 2 days and then to go down.
Well, if you are my father,
Yes.
you know,
Yep.
for my father I make everything.
Yes.
If you are my father, when you arrive,
When did I put here?
yeah, here, when?
About 2 hours ago.
Okay, I rest today,
Yes.
drink a lot of liquids,
Yes.
take my medicine,
Yes.
and go down to Debuche,
Right.
and after go to Namche,
Right.
because here is cold.
Right.
It's very cold,
Yes.
and I don't think so that you improve your health in this place,
Right. Okay.
because this place is the line between the high altitude and the middle altitude.
Yes. Yes.
That's the beginning, 4,000,
Yes. Yes.
and it's not good place to recovery.
Right. Understood.
My advice is that you take your medicine
Yeah.
and go down.
Right.
Maybe tomorrow if you feel okay.
Okay.
Because if not, you be in bad position with all these problems. Okay. I'd like to tell me if you have some questions to me.
Questions?
The base of the left lung, it's a little water,
Well done.
a lot of secretion, and that's when it's dangerous.